Hi, my name is Charles Ulrich. I have been following Senator Thom Tillis in social media. I've been looking at what he's been doing on the news and researching online, trying to figure out what he has been involved in since he's recently been elected. Two things that caught my eye was how he's been involved with attempting to repeal the Patient Protection and Affordable Care Act, and then also his stance against the utilization of taxpayer dollars to pay for abortions. Um, the first issue, the repealing of the Patient Protection and Affordable Care Act, I feel is important because I feel that this act was going to do more harm than good. I'm not saying that America doesn't need healthcare reform, because it does, but I don't think that this is the best policy or the best act for our nation. How issues affect nursing. These issues affect nursing directly because of the reimbursements from the Centers of Medicare and Medicaid services. These issues, one of the main issues is the penalties that are placed on hospitals by not meeting core measures, and how the government will withhold certain reimbursements at the end of the year depending on the hospital performance. I've heard of some hospitals losing over $1 million in this, and that can greatly affect the staffing in the amount of in what the patient can do as far as renovations and buying new equipment and hiring staff to care for patients. It seems like this would be a vicious cycle. Once started, it would be difficult to be caught back up, because when you have less staff, you still require the same amount of work and the same things to be done, even if you don't have the staff. By requiring more and more out of the staff, eventually it's going to cause the staff to not work there anymore, essentially. I am in support of a healthcare system that would be more favorable to all, but I don't feel that Obamacare or the Affordable Care Act, as properly named, is the best option at this time. I did research on several different articles. The first was Physician-Owned Specialty Hospitals in the Patient Protection and Affordable Care Act, Healthcare Reform at the Intersection of Law and Ethics. This article was not necessarily specific to nursing, but more the ethics of the Affordable Care Act, and how the people who are writing these bills should have the same code of ethics as physicians and nurses, because business ethics and healthcare ethics are truly different. And in order to be able to write something that would truly benefit patients or has patient care at the center, you have to have the same ethics. The second article that I researched was from a dermatology journal, The Ethical Considerations in Healthcare Reform, Pros and Cons of the Affordable Care Act. I got one quote from there that I thought was very interesting and hit the nail on the head. It states, "The takeover of the healthcare system by the federal government is just another example of loss of liberty and freedom in an attempt to create more dependence of individuals on the government." This was in paragraph 5. I feel that this is an accurate description of the Affordable Care Act, because it's not the government's place to be involved in making sure that everybody is insured. Healthcare is not a right, it's not a need, it is extra. It's not one of the things that people died for when fighting for their freedom. It wasn't to have a government provide healthcare for them. I believe that there needs to be a responsibility of people who are on these services such as Medicare and Medicaid, whether it be paying in or becoming independent after a certain period of time to get off these services. Whereas I'm seeing a lot of people who are fully dependent on these services and no intention of coming off of Medicaid. The third article that I did was the Patient Protection and Affordable Care Act, a dissenting opinion. I got one quote from there that was that was also very good and helping keep the focus of the American government. Even if we agree that it is unjust to deny some citizens access to necessary care, we must still recognize that resources are not unlimited and determine the best method for allocating those resources. This is true. I mean, we all know that we're already several $trillion in debt. We can't continue spending as if everything is okay, because we don't have the money to spend. We need to determine where the resources need to go, what will be the most beneficial, and how can we take care of the most people, and what is the most necessary. So this is just the beginning of the research that I've done. I have my bibliography posted right here, and I'll upload a link with that on it also. But it's been very informative so far, and I'm looking forward to continuing to learn more in the future about this.